Up until recently, construction on the South Niagara Hospital project has largely taken place below ground. With me is the Director of Transportation and Construction at Niagara Health, Patrick Topping. Patrick, the hospital's basement is 5 meters below the ground, and if you do the math, that's 16 feet deep. Is that right?
A little bit more than that.
A little bit more than that.
A little over 20.
But the superstructure is starting to come
it's
up, is
starting
that
to
right?
build up,
So
that's right.
take me through what the status of the project.
So yeah, this is the part of the project where we really start to get exciting because now you can see physically on site how it's transforming. Up until recently, we were doing a lot of the underground services, things that will feed the hospital from an electrical service standpoint, from a sanitary, sewer, water, things like that. And now we're starting to come out of the ground. All of that work has been done now, and now you'll start to see the building really take shape. So what we do now, you'll start to see the first suspended slabs start to go. So you'll see floor 1, floor 2, floor 3, and it'll be a very iterative process. So what happens is you'll see a portion of the first floor go up, and then the second all at once. One of the more visible elements too, you probably noticed on site as you're driven by, is those 4 tower cranes. Those will all be in place up until the end of the project and really aid in getting that construction up and out of the ground.
Speaking of driving by, so Montrose, Bigger Road, right off the Lions Creek, cut off of the QEW. I was telling you earlier, I have an aunt that's out that way, and the construction on the roads until they were expanding it was pretty intense, but that's all done now. So all that dirty work is pretty much done, so people can drive by, which is nice.
Yeah, that's right. And that was a huge portion of the project that we really wanted to ensure we nailed down early in the process. So we worked with our partners with the region, the city of Niagara Falls, and then all of the different utilities. So like NPI, which is Niagara Peninsula Energy, Enbridge, and all of the different telecoms to really make sure that work got done early and we got in as early as we could. So with that, as you say, we are nearing completion. We should have the top coat of asphalt done in and around the summer, midsummer, and then that will be completely open for public use.
That construction site, it's a busy place. Elliston is a very reliable contractor, but they have a lot of subcontractors and with a local spin, right?
Yeah, we were really fortunate that we don't have control over how Elliston chooses their contractors, although we did vouch very highly and encourage them to look at Niagara contractors. And to their benefit, they did go with a few very notable ones, people like Rankin DeQ, Touchstone Landscaping, Echo Electric, and then of course the local 303 IBEW for the electrical services. With that though, Rankin was also the chosen contractor for the off-site works. So having that marriage between the two with the works on-site and off-site really benefited to getting the project up and out of the ground and also finish those off-site works.
How is the relationship going with Elliston?
Oh, fantastic. They're an incredible partner, and one of the things around this project model is called the P3, which is the public-private partnership, and we really are a good partner with them. They give us some pushback, but we also do it as well in the benefit of the project. But right now it's a very great collaboration, and because of that, we've been able to exceed our expectations from a constructability standpoint.
And you're not just partnering or collaborating with just Elliston. You got to get the city involved, the region involved. Talk about that.
Yeah, so with that, Elliston has to go through a lot of the permitting process with any standard project, but it's up to them to do that. But because of our early relationship and the precedent that we set on getting those early works completed, we have a very great relationship with the city and with the region. So it's made that permitting process very easy for Elliston.
The number is 1.3 million square foot. Is that right? That's
right.
a big number.
It's a big number, and it is about 300,000 square feet larger than St. Catharines. So if you can picture that building, we're 300,000 square feet larger, and it's going to be 12 stories high. So it's going to be quite an imposing building as you drive by.
With our last few minutes, just tell me the features of what this hospital is going to provide.
Sure. So we're going to have 469 bed count, which is 156 total capacity increase throughout the region. We're also going to have a 24/7 emergency department that is around 3 times the size of the Niagara Falls Hospital right now. Also, one of the most exciting features that we're going to have is we're working towards being the first WELL certified building in Canada. Well certification is a very interesting thing because what it does is it sets precedent over the wellness and the well-being of all users of the hospital. So we have visitors, patients, staff, and with that, we have increased walkability throughout the site. We're going to have better daylight throughout the site and just overall better aesthetic and I'd say like natural enhancements throughout the building.
Reminder of viewers with some timelines. So approximately 2 years from now, April 2026, you're expecting the superstructure to be complete?
That's right. You'll see the building at its full height, then working to becoming watertight shortly after that. And then we will reach substantial completion in February of 2028. Substantial completion is a major milestone for us because that's when the building gets turned over from Ellis Don as the constructor to the contracting authority, Niagara Health. And then from there, we'll need about 6 months to transition fully and then operate the building.
You get out there about once a week, is that right?
Right now we're there once, twice a week with our team from a design and construction standpoint. So we monitor the construction from how it's proceeding and evolving.
Your thoughts so far?
I'm incredibly happy with the progress that I'm seeing. This is the kind of world that I grew up in construction, and it's what I really like. And I can tell you from a construction standpoint, Ellis Don's doing a great job.
Did you take a little bit of dirt from the site, old site, new site? Are you doing that? Are you keeping it on your mantle?
During the groundbreaking, I may or may not have taken one of the shovels home.
All right, I'll hold you to that. Is it gold? Or are you getting one of the gold ones?
This one didn't have a gold on it, but it did have a little plaque on it.
All right. Patrick, thank you so much, and all the best in the next 2 years. It's going to be busy.
Thank you.